you don't like it, but it's there. It's like a default setting, so let it be.
Hello. Hello, doctors. Can you hear me?
Yes. Yes.
Hello, Ela here.
Hello, Ila.
And I thought
Hello,
I'd
Ila.
try and match your background.
Yeah.
I'm in Kihim,
Oh, wow. Okay.
and
Okay.
I hope Dr. Dandekar is also hearing that.
Yes, I am so glad you are in Kihim. Kihim
Yes,
has
thank
a
you.
lot of memories for me.
Thank you. And in case I miss it later, season's greetings to all who are gathered here today.
Yeah. How nice.
Thank
Yeah.
you.
Yeah.
Good afternoon, doctor. This is Anup here.
Oh, hello,
I
Anu.
just joined.
How nice. How nice to see you. Yeah.
Yeah.
Actually, I must say, so many of the faces are familiar, and I feel so overjoyed. You know, I know due to lack of time, call it what you will, I'm not able to join often enough, but I'm glad we are together today. I think it is truly a privilege to be here with you. And
Sir, I don't think you need any introduction at all, but let me just,
yeah, please.
formally
Yeah.
still introduce. So we are very happy to welcome Dr. Vijay Haribhakti, the chairperson of the Department of Oncology at Sir H.N. Reliance Foundation. I'm sure almost all of you know Dr. Haribhakti. And we are very happy to say that yesterday, in fact, we celebrated the 10th year anniversary of our hospital. And I still remember, my first meeting with Dr. Haribhakti. Dr. Haribhakti ne mujhe phone kiya. I used to work at a different hospital, and he said, "Prasad, come and meet me." And when I came, which was actually around exactly 10 years ago,
Yeah.
in October
Mm.
2014, I was completely mesmerized by this setup. I was like, my God, what is this hospital? And it was such a pleasure to meet Dr. Hari Bhakti. And ever since our relationship, not just as colleague, but also as a mentor, has been fabulous. And Dr. Hari Bhakti has been supporting us for so many different initiatives. So we can, as a cancer support group, also benefits largely from Dr. Hari Bhakti's inputs. And of course, now we have made a habit कि हर अक्टूबर में डॉक्टर हरि भक्ति को बुला के we do one meeting, which becomes a very, very successful meeting. And Dr. Hari Bhakti has been leading the oncology department, and we have really achieved so many amazing things in last 10 years. So हमने सोचा कि last 10 सालों में not just Reliance Foundation Hospital but overall oncology में क्या क्या advances हुए हैं कि जिससे हमारे पेशेंट्स को काफ़ी फ़ायदा हुआ है, कैसे हमने ट्रीटमेंट और आउटकम्स को चेंज किया है, उसके बारे में हम डॉक्टर हरिभक्ति को बुलाए और उनसे सीखे, सुने, ताकि हमें भी एक आशा मिले कि नहीं, मेडिकल साइंस बहुत ही चेंज हो रहा है एंड थिंग्स आर इम्प्रूविंग वेरी फास्ट. So it's a pleasure and delight, Dr. Hari Bhakti, to be here. Thank you very much for taking time from your busy OPD. मुझे मालूम है आपके OPD के बाहर already 30-40 लोग बैठे हुए हैं.
नहीं, that's okay.
और and I must be getting really upset कि अरे डॉक्टर प्रसाद आप वापस हरि भक्ति सर को चुरा लिया हमसे. But this is important. This is important. Thank you very much. Over to you, sir.
So good morning, everybody. It is indeed a great pleasure for me to be with you. हम बेहद खुश हैं आपके साथ बातें करने के लिए. बहुत सारी बातें मन को आती है शेयर करने को, मगर मुझे लगता है कि क्योंकि हमने कल ही हमारी 10वीं सालगिरह थी, तो ये ठीक रहेगा कि हमारा संकल्प जो था, हॉस्पिटल का संकल्प, और कुछ हद तक वो हमारी ऑन्कोलॉजी सर्विस का भी संकल्प है, वो मैं आपके साथ शेयर करूं और उसके बाद कुछ बातें करूं. सो वो संकल्प इस तरह है. हमें कदर है जीवन की, क्योंकि जीवन अनमोल है. अनमोल है इसका हर पल. आशा, उम्मीद और खुशियों से भरी होनी चाहिए हर जिंदगी। हमें कदर है जीवन की, और हम चाहते हैं जब कभी इस जीवन को पूरी तरह जीने में कोई भी रुकावट आए, हम आपको दें बेहतर से बेहतर इलाज। हर बच्चे को, हर माता को, हर पिता को मिले पूरी सेवा, पूरा ध्यान। हम चाहते हैं हर जीवन को मिले पूरा सम्मान। हम हैं सर HN रिलायंस फाउंडेशन हॉस्पिटल। हमें कदर है जीवन की। सर HN रिलायंस फाउंडेशन हॉस्पिटल, सम्मान जिंदगी का। I think this pledge, in many ways, enshrines all that we have done and that we stand for in our department. And therefore, I thought there was no better way to begin. We care. I think that is fundamental. And that is something unchanging and will remain permanent. So what I want to say is, when we say everyone should get the best इलाज, हर किसी को मिले सबसे बेहतर इलाज, we have taken that seriously. In the field of surgery, we have introduced almost every advance that is conceivable anywhere in the world. I really can say with absolute certainty and with confidence, मैं बिल्कुल गर्व से कह सकता हूं कि हमारे यहां कोई कमी नहीं है। सर्जरी में हमने सब कुछ ऑफर किया है, जैसे कि मिनिमली इन्वेसिव सर्जरी, सर्जरी जिससे कम से कम तकलीफ होती है मरीज को, रोबोटिक सर्जरी। हम ऑफर करते हैं सबसे एडवांस्ड माइक्रोवैस्कुलर रिकंस्ट्रक्शन। हम ऑफर करते हैं पूरा रिकंस्ट्रक्शन, चाहे ब्रेस्ट में हो, चाहे हेड एंड नेक में हो, चाहे बदन में हो, चाहे बॉडी, चाहे कोई भी हड्डी में हो। कोई भी विभाग जो हम रिपेयर कर सकते हैं वो हम अवश्य करेंगे, और आपके लिए, हर एक पेशेंट के लिए जरूर करेंगे। और उसका कारण एक ही है कि वी आर फॉर्चुनेट कि हमारी हॉस्पिटल में हमें टेक्नोलॉजिकल सपोर्ट पूरा है, पूरा टेक्नोलॉजी सपोर्ट है। हमारी एक ही हॉस्पिटल होगी जिसमें हर एक पेशेंट का हर एक रिकॉर्ड, आप अगर आओ, आपको एक कागज भी लेके आने की जरूरत नहीं है। आपका हर डिटेल हमारे सिस्टम पे है और हम उसको देख सकते हैं। हर एक एक्सरे, ऑपरेशन नोट्स, हर चीज जो भी हमें जरूरत की हो हमारे पास मिलेगी। और ये बहुत बड़ी चीज है, क्योंकि हम उसके जरिए हमारे काम को भी देख सकते हैं। हम स्टॉक टेकिंग कर सकते हैं कि भाई हमने क्या सही किया, क्या गलत किया, क्या कमियां हैं, क्या हमें करना चाहिए। वो सब हम बार बार सोचते हैं और बार बार करते हैं। आपने शायद 10 साल पहले सुना होगा कि रेडियोथेरेपी में हमने शायद इंडिया का पहला ट्रू बीम मशीन लिया था। वो उस वक्त एकदम नया था और कहीं भी नहीं था, और हम बहुत खुश थे। मगर मगर 2 साल के अंदर बहुत सारी जगहों में आ गया। मगर सही बात है, हमने, अभी भी है वो मशीन मौजूद, और हमने उस पे बहुत सारे पेशेंट्स का ट्रीटमेंट किया। और गए साल हमने एक और मशीन लिया, उसका नाम है ईथॉस। अभी ईथॉस का मतलब है ये एडेप्टिव रेडिएशन। हर एक पेशेंट को हर एक बार रेडिएशन मिलते समय पूरा एक्यूरेसी, पूरी पूरी सहूलियत से रेडिएशन मिलेगा, जिससे उसके बुरे असर हो सके उतने कम हो जाएंगे। मेडिकल ऑन्कोलॉजी में भी हमने बहुत कुछ कदम उठाए हैं जिससे पेशेंट को सेफली और अच्छी तरह से कीमोथेरेपी मिले। और 2 साल से हमारे साथ डॉक्टर सेवंती लिमय जब से जुड़े हैं, हमने इंट्रोड्यूस किया है प्रिसिशन ऑन्कोलॉजी, यानी उसमें हर एक मरीज को जिसको कोई भी एडवांस मुश्किल बीमारी हो, उनका जीन्स के मुताबिक, मार्कर्स के मुताबिक क्या सबसे सही ट्रीटमेंट है, वो हम पता लगाते हैं और वो उसे देने की कोशिश करते हैं। तो हम ये कहना चाहते हैं कि हमने हर तरह से ये कोशिशें की, बट सबसे सबसे महत्वपूर्ण क्या है, और वो है हम सब एक है। हमारा पूरा डिपार्टमेंट एक है, हम एक पूरी टीम है। हम सबको हमारे फैमिली मेंबर्स की तरह रखते हैं और सबका प्यार, सबका पूरा इन्वॉल्वमेंट हमें मिलता है, और वो सबसे बड़ी चीज है। आपको शायद जानना चाहिए कि हर हफ्ते बिना मिस किए हर मंगलवार को सुबह 1.5 या 2 घंटे के लिए हम सब पेशेंट्स के लिए एक ट्यूमर बोर्ड रखते हैं, जिसमें 25 या 26 लोग होते हैं साथ में, और हर एक मरीज की पूरी हिस्ट्री पढ़ी जाती है। और हम ये सोचते हैं कि क्या सबसे सही जवाब होगा ये पेशेंट के लिए, और उस तरह से ट्रीटमेंट प्लानिंग होती है। तो आपको ये समझना है कि जब कोई भी आपके फैमिली का, आप भी यहाँ आओ, तब ये मत समझो कि आप केवल एक इंडिविजुअल के पास आते हो। आपको ये जानना है कि आपके पीछे एक पूरी टीम है, और वो टीम के पीछे भी बहुत बड़ी टीम है, और वो है सर H.N. रिलायंस फाउंडेशन हॉस्पिटल। हमारे हॉस्पिटल के हर डिपार्टमेंट, देखो रेडियोलॉजी, देखो पैथोलॉजी, देखो न्यूक्लियर मेडिसिन, देखो कोई भी डिपार्टमेंट में सब हमारे साथ है। और हम ये कहना चाहते हैं इस वक्त पे कि हर डिपार्टमेंट, पूरा नर्सिंग डिपार्टमेंट, सिक्योरिटी डिपार्टमेंट, हर कोई हमारी एफर्ट्स को सपोर्ट करता है। इसलिए हम देखते हैं कि जो एक्सपीरियंस मिलना चाहिए पेशेंट्स को, वो हम देना चाहते हैं। सबसे अहम एक बात है, मुझे याद है जब मुझे मिसेस अंबानी ने पूछा, मैं ज्वाइन भी नहीं हुआ था, उन्होंने पूछा कि क्या सबसे जरूरी चीज समझते हो ऑन्कोलॉजी के लिए, तो हमने बिना सोचे कह दिया, हमको सबसे अच्छा रिहैब चाहिए। हमको एक ऐसा रिहैब डिपार्टमेंट चाहिए जैसा कहीं भी ना हो। हर एक मरीज को हम चाहते हैं कि हम पूरी तरह से रिहैब दें। उन्होंने कहा सही है। और आप देखिए, आप में से कई ने देखा होगा हमारा रिहैब डिपार्टमेंट, शायद ही पूरे देश में ऐसा डिपार्टमेंट होगा। पूरी तरह से पेशेंट्स को सपोर्ट मिलता है, फिजिकल, साइकोलॉजिकल, इमोशनल। मैं देख रहा हूं कि डॉक्टर मेहजबीन भी है, शायद मेहजबीन, आर यू देयर? आई सॉ यू सम टाइम बैक। या
Yes, sir, I'm here.
या
I'm here, sir.
या
Thank you.
सो we have people who are empathetic, people who care. We have speech and swallowing therapists. We have physical therapists. We have occupational therapists. We have every type of support therapy available. Most recently, we have taken on an individual who completely looks after the emotional and physical well-being of patients post-treatment. because treatment is just, we believe the actual treatment is only a part of the whole. What I mean is, management is what is important, and in management has to be holistic, पूरी तरह से, ताकि कोई भी कमी नहीं आनी चाहिए। और ये सब होते हुए भी हमारे पास कोई कमी नहीं है ऑपरेशन की, रेडिएशन की, कीमोथेरेपी, फिर भी हमने पहले से ये दृढ़ प्रण लिया है कि हम दो चीज के पीछे रहेंगे, वो है प्रिवेंशन और अर्ली डायग्नोसिस। वो बहुत ही इंपॉर्टेंट चीजें हैं। हमारे देश में कैंसर बहुत तेजी से बढ़ रहा है और हमें किसी भी तरह उसे रोकना है। तो हमने उसके लिए एक काफी इंपॉर्टेंट प्रोग्राम निर्माण किया था, और मैं जल्दी से आपको बता दूं उसका मतलब क्या है। उसका शॉर्ट फॉर्म है सीड्स, SEEDS, द सीड्स ऑफ प्रिवेंशन एंड अर्ली डायग्नोसिस। सो पहला S हमारे लिए, हमारे देश में है शन टबैको। हम चाहते हैं कि किसी भी तरह, किसी भी फॉर्म में तंबाकू का सेवन बंद होना चाहिए पूरे देश में, पूरी प्रजा में। आप सब जो हो, मैं देख रहा हूं आज 45 लोग साथ में हैं, आप सब हमारे एम्बेसडर्स हो जाइए और पूरी तरह से अपने घर में, हमारे आपके घर में, आपके बार में, आपके फ्रेंड्स में, सबको कहो कि तंबाकू सबसे बड़ा प्रॉब्लम है हमारे देश में, और उसकी वजह से 50% कैंसर और 50% कैंसर के डेथ होते हैं और बहुत ज्यादा सफरिंग होती है। सो फर्स्ट S is shun tobacco in all its forms, whether it's smoked tobacco, chewed tobacco, snuff tobacco, any form of tobacco. The second is E, which is eat right. ये बहुत जरूरी है कि हम ठीक तरह से हमारे डाइट की चिंता करें ताकि हमारी जिंदगी हेल्दी रहे। और ये एडवाइस तो बहुत ही इंपॉर्टेंट है, क्योंकि इससे न सिर्फ कैंसर मगर हार्ट डिजीज और न्यूरोलॉजिकल डिजीज भी कम हो जाएंगे। सो उसमें हम ये कहेंगे, ये देखिए कि आप सैचुरेटेड फैट्स कम करें, प्रोटीन का इंटेक ज्यादा रखें, नेचुरल आइटम्स, नेचुरल फूड्स, नेचुरल विटामिन्स का इंटेक ज्यादा रखें। और रफेज, सबसे इंपॉर्टेंट चीज है रफेज, जिसकी वजह से आपको आंत की बीमारियां न हो। सो इट्स वेरी इंपॉर्टेंट कि वी हैव अ बैलेंस्ड डाइट विच इज रिच इन प्रोटीन, मॉडरेट इन कार्बोहाइड्रेट, low in fat, high in roughage, and that is going to help us overall with good health. The next E is exercise regularly. मैं कैसे बताऊं? एक्सरसाइज एक ऐसी चीज है जिसका मोल आप लगा नहीं सकते हो। बहुत ही इंपॉर्टेंट है कि हम सब फिट रहे और हम अच्छी तरह से हमारे बॉडी का ध्यान रखें। सो एक्सरसाइज रेगुलरली इज वेरी इंपॉर्टेंट। उससे अगर आपको कोई ट्रीटमेंट भी चालू हो तो उससे काफी काफी फायदा होगा। दैट इज वेरी वेरी इंपॉर्टेंट। सो एक्सरसाइज रेगुलरली। नेक्स्ट वी कम टू D, which is dump obesity, alcohol and excess intake. So मैं सबको कहना चाहता हूं कि बॉडी वेट, बॉडी मास नॉर्मल रखने में बहुत फायदे हैं। मैं बता नहीं सकता डिटेल में, ये एक छोटा सा टॉक है, मगर ये बहुत जरूरी है कि एक्सेस वेट हम अवॉइड करें। और अल्कोहल अगर आप लेते भी हो तो बिल्कुल मात्रा में, एक्सेस बिल्कुल नहीं होना चाहिए। उससे काफी सारी तकलीफें हैं और कई कैंसर्स भी उससे फ्यूल होते हैं। सो अगर आग लगी हो तो हम केरोसिन नहीं डालते हैं उस आग पे, हम बुझा देते हैं उस आग को। सो मैं चाहता हूं कि अवॉइड अल्कोहल एज अ पोटेंशिएटिंग फैक्टर। और फाइनली सीड्स इज एस, स्टे विजिलेंट। कैंसर के कुछ साइंस हैं जो आप सबको पता होने चाहिए और जो पूरी आबादी को जान होने चाहिए, ताकि कोई भी जल्दी आ सकता है डॉक्टर के पास, जल्दी डायग्नोसिस दे सकते हैं और हम अच्छी तरह से ध्यान रख सकते हैं। उसमें यह भी जानना चाहिए कुछ कैंसर्स जो हेरिडिटरी आते हैं उसके लिए क्या किया जाए। उसके लिए भी हम एक खास प्रोग्राम निर्माण करने जा रहे हैं और सून वो पोजीशन में आ जाएगा। उसको जेनेटिक काउंसलिंग कहते हैं, जो कैंसर्स जेनेटिक्स से जुड़े हुए हैं। वो साइंस तो आप सब जानते हैं। अगर कोई घाव जो ठीक नहीं हो रहा हो, अगर बिना किसी कारण के वजन कम हो गया, भूख कम हो गई, बुखार लंबे समय के लिए बिना किसी कारण के, वजन कम हो गया, अगर बॉवल के हैबिट्स एकदम बदल गए, अगर खून कोई गलत जगह से आ गया, या तो पेशाब में या दस्त में या ब्रेस्ट के डिस्चार्ज में या खांसी में, वो रिपोर्ट करना चाहिए। आपको ये भी जानना है कि अगर कोई भी मसा या कोई भी मोल हो और वो एकदम चेंज हो जाए तो रिपोर्ट करना चाहिए। तो मैं ये कहता हूं, ये ध्यान में रखने से सबको, पूरी आबादी को और पेशेंट्स को भी ध्यान में रखना चाहिए किस किस वक्त और किस कारण डॉक्टर के पास जाना चाहिए। तो हम ये कहेंगे अंत में, क्योंकि मैं आज आप सबको सुनना चाहता हूं। आप मुझे कहो तो मैं पूरा 1 घंटा बोल सकता हूं, मगर वो सही नहीं है। मैं जानने चाहता हूं कि आप सब की क्या राय है। आपने एक बहुत बहुत बड़ा काम किया है, आपने ट्रीटमेंट झेल ली है और हम सीखना चाहते हैं आपसे कि आपने कैसे ये किया। ये बहुत महान अचीवमेंट है आपकी, और इसलिए मैं समझता हूं कि ये सपोर्ट ग्रुप बहुत ही अहम है। क्योंकि आखिर में हम क्यों हैं यहाँ इस जिंदगी में? दूसरों के लिए। अपने आप के लिए अगर जिंदगी जीनी हो तो वो खोखली हो जाती है। सो मैं यही कहूंगा कि ये जिंदगी बड़ी कीमती है, बड़ी अनमोल है, उसको अच्छी तरह से जीना है। हम चाहते हैं कि आप सबकी जिंदगी हम ठीक तरह से दे दें। हम चाहते हैं कि आपके परिवार में, आपके दोस्तों में, सब में आप ये सब जो आपको इंफॉर्मेशन, नॉलेज जो भी मिला हो, आप शेयर करो, ताकि आप हमारी मदद करो। हम चाहते हैं कि हम किसी भी तरह से अपने देश में ये बीमारी का जोर कम करें या काबू में लाए। सो आई वुड एंड बाय सेइंग जस्ट अगेन फ्रॉम आवर प्लेज कि हमें कदर है जीवन की और हमें सम्मान है जिंदगी का। That's it. I think this is what we stand for. This is what we will always stand for. And we now want to know what all of you have to say. Why don't
Thank
we?
you very much, sir.
Yeah, yeah.
So before we open up for questions, मैं एक बात बताना चाहता हूँ कि डॉक्टर हरिभक्ति ने अभी जो लाइफस्टाइल के बारे में, सीड्स प्रोग्राम के बारे में जो सब बताया, Dr. Haribhakti actually is an embodiment of that. This is how he lives his life. I mean, those of you who know him, whether it is his diet or exercise or everything, he runs his life so perfectly and it is an inspiration. I'm 20 years younger than him, and I hope I when I grow up like him. It's amazing how he conducts his life. So it's a big inspiration for us, sir. So let's open up for questions for Dr. Haribhakti.
Yeah.
So you can unmute yourself and ask a question if you like. आप unmute करके सवाल पूछ सकते हैं.
Hi, sir. Good afternoon. Vidya Prabha here. So you did my surgery in 2019 August. So it's been now 5+ years. So my query is like, with God's grace and blessings of the doctors from HN, everything is fine. I'm taking my the medications like hormone tablets and everything. So we normally tell that if you complete 5
Hi,
years
sir.
or a particular milestone,
Good afternoon.
then the percentage of recurrence chances will come down, sort of. So I just wanted to know from your side, like, is it true? Can we have can I take a long breath now, at least, like, some milestone is achieved or something like that?
Good afternoon, sir.
So I'll tell you something. Yes, 5 years is an important landmark and you should celebrate. So firstly, go and celebrate that you've completed 5 years. At the same time, I have to say that follow-ups are necessary. We need to keep seeing you. We'll need to see you less frequently. We can maybe see you, and now since 5 years over, we can see you once a year. सालाना एक बार देख सकते हैं. मगर वो जरूरी है क्योंकि ये एक ऐसी चीज है जिसमें पूरी दुनिया में ये क्लियरली पुरवार किया गया है कि फॉलोअप्स से बहुत ही एडवांटेज मिलता है. कोई भी, अब भले हम आपको 5 या 10 मिनट भी देख ले, मगर कुछ भी आपके सिम्टम्स सुन के या आपको तपासने पे कुछ भी हमको साइन मिले तो वो जरूरी है. सो मैं यही कहूंगा, डोंट वरी, टेंशन बिल्कुल नहीं लो, मगर फॉलो अप जरूर चालू रखो.
जी सर. सो आपसे भी मिलना है क्या? बिकॉज आई एम फॉलोइंग अप विथ माय मेडिकल oncologist who is Dr. Mehboob Basade. So
Yeah.
this month also, initially I was there on 11th of October for his follow-up. So it was 6 monthly. Now he said I can come 8 monthly. So is it, I mean, should I come to you also for the follow-up, or he is okay?
So I'll put it this way. You don't need to go to two different specialists in the same period of time, but maybe spaced out by 6 months. So if you see him, then 6 months later, you can see us, because each person contributes. Like as a surgeon, I look at a patient in a certain way, which is distinct from a way a medical oncologist can see a patient. So you cannot, unfortunately, take away the importance of a detailed assessment by all the specialists. So yes, I think it is important. Yeah.
Sure, sir. Thank you so much, sir.
Yeah.
Hi, sir. Nitin Maniar.
Yes.
Good afternoon.
Okay.
6 months back, you operated me in the May.
Yeah.
My oral cancers here due to the. I heard your other things, and I'm already pushing now to stop the tobacco to everyone in my field everywhere. It's
Yeah.
real. You say it's the right thing, and we should come again forward.
Yeah. So you
Yeah.
see, that's very important.
Yeah.
If you become an ambassador for something important, it brings a very, very significant purpose to your life.
Yeah.
If you stop tobacco in even 20 people around you, you've done a great favor to them. That's very.
Correct. I really appreciate and agree, and I already started in my
Yeah.
group everywhere.
Yeah.
I slapped my one friend also. You don't stop.
Okay.
Just see my condition.
Yeah.
See, everybody
you
does.
look quite good. You look quite good. Anyway.
Sir, thanks to you.
Yeah. So,
Thanks to the rehab area. Due to the rehab, what you say is really good rehab.
yeah.
And one thing is the reliance, the management, it gives me the so positiveness to come out
Good.
in the hospital.
Yeah.
And Maniarji, if you want, we can also have a meeting with your. So this is something which I'm saying to everyone. अगर आपकी फैमिली है या अगर आपके फ्रेंड्स हैं जिनको आपको कैंसर के ऊपर या टोबैको प्रिवेंशन के ऊपर टॉक देना है, तो
Yeah,
आप जरूर हमें बताइए. वी विल बी वेरी हैप्पी टू डू इट इफ
sure.
पॉसिबल इन पर्सन, बट डेफिनेटली वर्चुअली. Whether it is me, Dr. Hari Bhakti, Dr. Sevanti, any one of us, we'll
Sure,
definitely
sir.
find time and do it.
I'm
Just let
really
us know.
appreciate. I really appreciate
Yeah, sure, absolutely.
because awareness to give everyone, because you suffer, so they could know
Yeah.
in a group.
I mean, today, nothing else will work like awareness. Nothing will work like awareness. And people taking responsibility for their health. I think that's very important. Yeah. Yeah.
Good
Yeah.
afternoon, Haribhakti sir. This is Anup here.
Yes, yes.
Sir,
Sir.
the 3 points which you said right now regarding diet, exercise, and obesity, I
Right.
think those are very crucial ones and which I have realized quite a lot. And in fact, in past few years, when I started meeting you and Dr. Sevanti Limai, this has become a very focal point for me for all the three. In fact, after you operated me, I have almost lost 20 kgs. So I've come down on that. I'm working out on terms of workouts and diet. I think with this is a very critical thing
Yeah.
which can give you a lot of positive result of the medications which you are having.
Yeah.
This is
So
what
I
my
must
personal
tell,
thing is.
let me share with everyone that you're planning to run the marathon this time.
Yes,
So,
yes.
so that's good. See that's the spirit. I mean, I'm telling you,
Hmm.
you cannot imagine what Anup has gone through. It is amazing that he is talking to us and that he's planning to run the marathon because it's
Yes,
really very inspiring, exemplary, and
yes.
admirable. Anup.
Hmm. Thank you.
Truly, yeah.
Huh. Uh,
Kajal, I think you wanted to say something.
Yeah,
yes,
sure.
yes. Hello, doctor. Hello.
Hello.
So I'm undergoing chemotherapy, doctor, and you operated me in August. So recently, I read somewhere that few of the cases lose their life because of the harsh chemo and radiation. Because see, this is part and parcel of the treatment. However, this does impact your vital organs as well, right? I
Mhm.
want to understand from you a brief that should we be scared of this statement, because I am into my early 40s and I'm taking chemotherapies every 2 week, which is definitely a dose dense given by Dr. Limai. But at back of my mind, I'm saying in aspect of saving something, am I hurting the other vital organs?
Okay. So I'll answer it this way. So, this is important what you're saying, and this concern is extremely valid because it's true. It is very true that they are called cytotoxic drugs because these drugs are toxic. At the same time, I think the way it is administered and all the pre and post chemotherapy management that is carried out, say in your case by Dr. Sevanti Limai, it a lot of thinking goes into it, and it is important for you to comply, because what we find is if that is complied with, the incidence of long-term problems is minimized. So I think yes, one has to be aware of it, but you also have to follow all the advice that is given to prevent long-term toxicity. So yes, I mean, it is toxic, but one has to do everything, and with good management we are able to almost completely remove the effects of long-term toxicity. So yeah, I mean, you're right, and you can help it by being very compliant to all that is advised to you. And you'll undergo periodic testing and all of that. All that is necessary and important.
Thank you, doctor.
Yeah. Anybody else would like to share your experience? I'm not I mean, today I'm not wearing the hat of just a doctor who's going to operate somebody. I want to know your feelings, your how you dealt with it. Is there anybody who would like to share how you dealt with it? How you dealt with. I'm sure there must have been stress at some point, and what helped you with that? Would somebody like to share that, perhaps?
So there are a few questions in the chat box and few comments. I would read it out to you.
Yeah.
One person is asking, is it normal to lose weight after radiation?
Oh, absolutely. It is very normal, especially in radiation to the mouth and throat, because there is definitely a diminished ability to eat normal food during the radiation. All that with good rehab will go away with time. But yes, it is normal and that's why in our department we have a package with rehabilitation, so that this aspect is taken care of very well. So yes, we would like to, our goal would be to make sure that nobody loses weight due to less intake. And we do succeed quite often, but there are times when we don't. And then don't worry about it. It will all happen because it's because of a transient disturbance in function.
Yeah. In fact, many of you who have been through radiation department at Reliance Foundation Hospital would know that we monitor the weight every day. And the reason we do that is because we are delivering high precision radiotherapy. Any changes in the weight actually makes the radiation less accurate. So we don't want patients to lose weight. And you would have known that if the patient loses weight, we of course try to compensate it by diet. Sometimes we even rarely ask the patient to put in a feeding tube or something. But the idea is to keep a very tight watch on what is happening to patient's health so that we can avoid the short term as well as long term complications. And some of you may have felt really harassed by me and my team that you are just forcing us to eat, you are just forcing us to eat. I can't eat, I don't feel like eating, and I keep almost terrorizing all my patients. And I can assure you, I don't feel good about terrorizing all of you, but I know in my heart that that is what we have to do, because we can see if we don't do it, you're going to have more problems. So sorry for being, so insistent on eating, but we truly believe that is what we do need to do.
Yeah. So I'm just looking, since you told me, I'm looking at the chat box and I'm just saying, yeah. Yeah, so I'm just saying, sir, मुझे ऐड किया गया उसमें friend.
Hello.
Yeah,
Can I
yeah,
can I talk?
yeah, sure, please.
Actually, my mother had simple breast cancer, so she was asking that do I need to also get genetic testing or BRCA testing done? Daughter of her.
Okay, so let me answer that. Let me answer that in a way that is very important. Now, what age did your mother develop it?
53, 54, 53,
So she was
53.
quite young.
Yeah.
She was quite young. See, we need to go into details of what age did it happen. Is there also
But
history in
no history, no history. It was she was
in any other family members like
no,
grandmother, the
no,
Masis, and everything?
never, no.
Uh, well,
Hello?
so yeah. So
Uh,
okay. So since you asked that question, I will answer it.
Yeah,
I will say, okay,
yeah.
okay, the fact that she has had it is important, but the importance is also dependent upon the type of cancer it was, how
Simple,
aggressive it was,
simple
and
breast cancer, simple breast
no,
cancer.
but there's no such thing as simple breast cancer. We need to know details about the hormone receptor status, the HER2 status, and all that.
Ghulam.
hello, sir.
Yeah.
Hello?
Yeah.
Hello?
Yes.
Hello,
Yeah,
sir.
I will let you know the details in.
Huh.
short while. Yeah.
Yeah, so we need to know those details, and then let me complete the answer.
Yeah.
So based on we take an estimate of the risk profile, and then yes, we do it, but we need to counsel everybody who does the BRCA test that. Sorry, is somebody?
I'm gonna mute the participants who are speaking. Let me find them.
Okay, no problem.
Yeah. I'm listening. I'm listening.
No,
Yeah.
so what I'm saying is, we need to counsel everybody who undergoes the BRCA test that what the implications of a positive outcome are, what it may involve, and then only do it. So it's not something we can
The
kind of advise like a blood test.
RT-BCS, ER positive.
Huh.
HER2 negative.
Yeah, so these are low risk cancers, and it's not essential in every case to do it. So what I would suggest is you whenever you're coming for a follow-up, or whoever you are following up with, you can just check if there is a need to, because you see, it's like this: once you do it, it becomes knowledge that you have, and then you can't escape it. For example, if somebody is BRCA1 positive and is bilateral removal of both the breasts and both the ovaries, it becomes too much at a young age. So that's why yes, we cannot run away from it, but I think it has to be done with a complete sense of responsibility. So I strongly feel a genetic counsel is important and should be done before you go for the testing. Yeah.
Okay. Oh, thank you.
Yeah.
हेलो
Yes. Yeah.
डॉक्टर मुझे अभी 2 साल हो गए कंप्लीट. मुझे भी राइट साइड में ब्रेस्ट कैंसर था. तो अभी मेरा जोलोडेक्स चालू था, वो भी कंप्लीट हो गया इस महीने में. तो डॉक्टर बोल रहे थे कि मतलब पीरियड्स फिर से आ जाएंगे तो मुझे ओवरीज निकालना पड़ेगा, ऐसा बोल रहे थे.
देखिए, सी ये सब एडवाइस है ना, हर एक का इंडिविजुअल रहता है. सो इट्स बेटर कि ये आप जब आप कंसल्टेशन के लिए आओ, तभी हम पूरी तरह से आंसर, या आपके जो भी आपके डॉक्टर है वो आपसे बता दें.
डॉक्टर अडवाणी.
हाँ, सो वेरी गुड. तो डॉक्टर अडवाणी आपको ठीक तरह से समझा देंगे कि क्या करना चाहिए, बिकॉज ये सब डिटेल को जाने बिना ये सही नहीं है मैं आपको एडवाइस दूं इस तरह से. सो बेटर कि जिसको आपके बारे में सब कुछ पता हो वही आपको एडवाइस दे.
ओके थैंक यू.
Any more questions? Mezabin, you're keeping track of that? Yeah.
Yes, sir, I am.
Yeah. Okay.
Sir, I also wanted to highlight one thing while we are awaiting more questions. As we celebrate 10 years of Reliance Foundation Hospital success, I also want to give a shout out to Dr. Amol Kakade. I think Amol has joined the meeting also. So Dr. Amol has been with us for many years now. But Dr. Amol has done something quite amazing. He runs a pediatric radiation oncology clinic, which is a very unique clinic. कि इंडिया में ऐसा कोई क्लिनिक नहीं है टाटा मेमोरियल हॉस्पिटल छोड़ के. और इसमें basically now we have treated, sir, more than 100 patients with radiotherapy. Dr. Amol, if you are on the call, do you want to tell us a little bit about the clinic and
Yeah,
your
let me add. Yes, I totally second that. I think Amol has really done great things. He has also very critically analyzed the results of certain protocols of radiotherapy. And so, yes, I think we are very fortunate to have him. And yes, I think the pediatric clinic is an absolute boon. I mean, to the community and to the society at large. Yes, Amol. Yeah.
Amol? We can't hear Dr.
Amol,
Amol.
hello.
Yeah,
Ha,
yeah.
now we can hear you.
Yeah. Hello, sir. Good afternoon, sir. Thank you very much. Thank you very much, sir, for mentioning about me. And very happy to witnessing this day today. Very fortunate that we completed 10 years of our service and with the best of the abilities and skills as well as with the services that we provide. And Dr. Haribhakti sir as well as Dr. Prasad sir has already mentioned about it in today's talk. Yes, we started pediatric radiation oncology along with the other interests of treating other malignancies. We started pediatric radiation oncology clinic around 2 years back, and very successfully we have completed more than 100 pediatric patients, children from as young as 3 months old babies to treating up to 15 to 16 years of age of children. So, very unique way in the we that we see pediatric patients, we have to take much more care because, as we
Yes.
know, they cannot mention about their symptoms or the problems they are suffering. Also, the parents are very much concerned and very so we have to very sympathetically, empathetically, as well as emotionally support them. Also, there are financial constraints sometimes, so we try to provide here as much as support to them, not only in terms of treatment related, whether they are very worried about the overall prognosis, how their child is going to better, not only because here the question is not about just survival or from the disease, but also overall how is the child going to live, what will be the growth problems, or will there be any mental abnormalities or physical abnormalities in the future.
Mm.
So these are a lot of issues and concerns that these children have and the parents have.
Mm.
So we take into account all of this, and it is only because of the infrastructure as well as the support that is provided by our hospital, and as well as the mentorship of Dr. Haribhakti sir and Dr. Prasad, we are able to do all of this and successfully treat this patient. So I am very happy, and also it's like a celebration that we are completing a hundred more than 100
That's
pediatric patients now,
fantastic.
and very soon, yeah, very soon we'll be also be celebrating in a better way.
Mm.
So thank you very much, and I really appreciate everyone joining here and giving me the opportunity to talk. Thank you very much.
Okay.
थैंक्स अमोल। बट मैं आपसे एक बात शेयर करना चाहूँगा, कल हमारे हॉस्पिटल में बहुत बड़ी इवेंट थी ये वो। सो डिपार्टमेंट हमारा थोड़ा जल्दी हमने बंद किया बिकॉज देयर वर सम सॉफ्टवेयर अपडेट्स एंड आई वाज गोइंग पास्ट एंड ये जो बच्चे हम ट्रीट करते हैं उनको एनेस्थीसिया में ट्रीट करना पड़ता है। सो they are fasting, they are crying, they're irritated, everything. And as I was walking past, one of her therapists, Vagish, was actually holding one child and comforting him and walking around while the parents were sitting there, not able to comfort the child. And it was just so beautiful to see that child feel comfortable in his arms and calm down. And I
Yeah.
think that moment was, for me, the essence of what we do at Reliance Foundation Hospital,
Yeah.
going beyond service. And I almost had tears in my eyes looking at that. I felt so proud and happy.
True.
So, and Vagish is also, I think, on the call. Thanks, Vagish, for
Yeah.
providing such a care. And not just Vagish, the entire team, I think, has been fantastic.
Yes, of course, of course. No, no, it is as much as we do, we need to keep doing it and keep doing it more because that is, I mean, total care is way beyond just treatment. We all realize it, we all know it, and and yes, I think that's why we are all here together on this call because that is what it's all about. We want every single person to get back to a life of productivity, of happiness, and of joy. I mean, you need to get back into a life that is worthwhile. We don't want a situation where the treatment or the management is worse than the disease. That doesn't make sense. We need to realize this very deeply, and 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 yeah, we do our best. We I have to admit, succeed variably. It cannot be the same in all patients, but yeah, that is the goal. Yeah. So yes, I think it's been a wonderful morning, and since are there any more questions or comments or shares? Otherwise, we can
I would just
Okay,
like to
let's just
add
invite
one.
Mazabin to
sure,
share a few words.
sure, Mazabin, yes.
So I would just like to extend a very, very warm thank you to Dr. Haribhakti for taking out such an important 1 hour of your day to talk with us, give us such enlightening information. And just the fact that you are there on the call, sir, is such a very, very important supportive factor for all of us. Your leadership, your mentorship has allowed us to make this support group work month after month over these so many years. And I think all of our patients over here, everybody on the call, just by looking at you, we feel so much better. So thank you so much
Thank you
for
for
your
saying
time.
that, because I think you are the true heroes for this. I mean, I would like to do more, and yet I wish the day had more than 24 hours. So that's where the problem lies. But yes, yeah, yeah, yeah.
Thank you so much, sir. And of course, with your leadership and Dr. Dandekar's support, we keep going on month after month, and we hope that all of our patients are very, very happy. All of our patients get the maximum care, the best kind of care that
Mm,
we have to offer at
absolutely,
every stage of their life.
absolutely, absolutely. That's what it's all about, and we will live with that. Uh, and we will pass. At least I have to think, not have to. I do regularly. I know this is what I want to pass on. I mean, I'm not going to go on forever. So that's, you know, we have to realize that that is what matters, and that's what everyone following us has to do. I mean, so yes.
Thank you so much,
Thank you
sir.
very much, sir.
Thank
Hey,
We
you.
have, I will share the YouTube recording also in some time.
yeah,
And let's continue interacting and making this group more vibrant. We
yeah.
do request you to invite your family friends to join this group. Also, if you know some other cancer patients who would benefit from this, please feel free to ask them to join. And we look forward to seeing you post Diwali in November for the November meeting. Happy Diwali in advance to all of you from the entire Alliance Foundation Hospital family.
Yes,
Same
so
to
I
you,
would
sir.
like to
Same to
say a
you.
Happy
very
Diwali,
happy
sir.
Diwali.
Happy
Happy
Diwali
Diwali.
to
Very
all.
happy Diwali to all of you. Have a
Happy
very
Diwali.
very joyous Diwali and a very prosperous and peaceful New Year. Yeah.
Thank you so much, sir.
Thank you so
Thank
much, sir.
you.
Thank
Bye
you.
bye.
Happy Diwali to
Happy
all.
Diwali to all of
Yeah.
us. Happy Diwali, everyone. Bye
Happy
bye.
Diwali, everyone.